every part of my life is affected by endometriosis.
For me, endometriosis has always been tied to fertility.
I couldn't eat, I couldn't talk, I couldn't stand.
I wouldn't realize that wasn't normal until I had surgery to remove endometriosis.
Not having the right diagnosis for so long, for more than 20 years, there's damage.
It can be very localized, it can be very simple, or it can be very, very complicated.
And this is why I started researching myself, because I needed answers.
I'm Dr. Tamar Zelovich, an OBGYN, gynecologic surgeon, and the host of Health Starts With Her. Today we're talking about endometriosis, a chronic and often debilitating condition that can affect 1 in 10 women. And many women feel that they've been dismissed or struggled with this condition for many years. You'll hear from 2 incredible women sharing their personal journeys, Dr. Tamar Zelovich, co-founder and CEO of SymptoLab, and Christine, a strategist in packaged goods and one of my patients. A special thank you to our sponsors, Cooper Surgical, Serene Endometrial Cryotherapy, and Altiva RCM. We could not do this without you. Now let's get to it. So I'm so glad that you guys are here today to join me for our discussion on endometriosis. So I'll start with you, Christine. Tell us a little bit about where your journey started with endometriosis and what that looked like.
For me, my journey started before I knew I had endometriosis. When I got my period, it used to be really painful. For a day or two, I'd be on pain medicine. I had very long periods, really heavy flows. And I thought that was normal. I was told, you can go on birth control to manage it. And that was it. And I was a teenager and that was my period. And I got used to it. And then in my early 20s, I started having a lot of gastro pain. And so I did all kinds of testing and we didn't find anything. And we were told that was good news. And I probably had IBS, but I might have endometriosis. And that was it. And so the next time I heard about endometriosis was when I was about 10 years later. I was in my early 30s. I was thinking about getting pregnant. And I was seeing an acupuncturist, actually. And it was a great experience. I brought up fertility and I mentioned, I might have endometriosis. This is what a doctor told me 10 years ago.
Yeah.
And she said, there's an amazing center in New York City. You should go check it out. See if you do have it, if you are concerned about it. And so that's when we first got connected.
Wow.
It's always been something I thought I had, but I didn't know. And I wouldn't know until I had surgery.
Got it. Yeah, I think that's so common. A lot of women are started on birth control very young, like you just described, and they start having periods and the periods are really bad. Maybe they start their periods at 12, 13. I mean, for some women, obviously it's earlier, and it's very painful. And then the solution is just birth control and it sort of masks it, I think, for a very, very long time sometimes.
And I wouldn't realize that wasn't normal until I had surgery to remove endometriosis. And then I wasn't in pain and I could live my life more normally. But you don't know.
Right.
Because pain is supposed to be normal for a lot of women.
Yeah. And so you don't know what's normal until you feel pain-free, right? Yeah. You don't know that is supposed to be how you feel until sometimes you have the treatment to get to restore the normal, to restore the anatomy. And what about you, Tammy? When did your journey with endometriosis first start, if you recall?
So I suffered, same as Christine, my entire life from symptoms since I got my first period. It started from just really painful periods that my mom used to say it's normal. Obviously, she probably had it as well. And it got into IBS. And my entire life, it was around it, but I lived around it. And it was okay, I guess, until I moved to New York. And then at a certain point, my health condition got way worse. And it was slowly, and got worse and worse until I couldn't eat, I couldn't talk, I couldn't stand. They thought that, and then I started getting all kinds of different diagnoses from myocarditis and anorexia and Crohn and colitis, depression, voice inflammation in the vocal cords, and every possible diagnosis, just not endometriosis.
Right.
I didn't get my period for 20 years. I was on birth control. No one even thought it can be that. I never heard about that until I diagnosed myself with endo, and this is where the journey began, I guess.
Yeah. And you both have such, I think, very distinct journeys that are also so different. But many women, I think, have these types of journeys where they have this set of sort of elusive symptoms even that no one can quite figure out. How did the symptoms impact your daily quality of life?
For me, when I was younger, I had a lot of pain, and it got better as I got to my late 20s and my 30s. It's been manageable. I think for me, the pain now is very emotional. And, we'll talk more about fertility, but for me, endometriosis has always been tied to fertility. And so physically, I feel great and my periods are better. But there's a lot of emotional pain that comes with endometriosis that probably affects my day-to-day the most now.
I think that's a huge, huge piece of it that we're definitely going to talk about.
I think endometriosis is unfortunately who I am. Every part of my life is affected by endometriosis. Before I knew I have endometriosis, I always have pain in bowel movements, and again, they call it IBS, but the pain, sorry for saying it like that, but it's like having appendicitis in your rectum.
Yeah.
And that's something, and you have to go to the bathroom when that happens, and the pain is so bad that it stresses you out. So without even knowing what I have for 20 years, I suddenly moved. I couldn't live far from the university. I had to live in the city. I couldn't, I was so afraid of be stuck in traffic and something happened. So I used to live at home. If I had to have a drive at 5 a.m., I would never go for trips with someone that is not my family or my, closest friends, and everything around. It was always a struggle. But then I did move by myself to New York, and I handled that. And then when it got really bad, and I was 2 years in bed, so obviously it affected every part of my life. But even today, I had already 3 surgeries in the last, I think, 7 years, and fertility treatments and everything. I just removed all of the organs. But I mean, not having the right diagnosis for so long, for more than 20 years, there's damage. And sometimes it damage, and it takes a long time to repair that even, and not necessarily you can. So now I'm recovering from the surgery, and I still have all the issues like the foot drop and the sciatic, and it's not because I had endo there, but the endo can affect other things that can cause other problems in muscles or inflammation or whatever. And my life is like a constant search for the right treatment, to understand the problem, to try and fix it. And during that, I want to live my life, but I also need to be very aware of how I live it. So I can travel, but I need to take wheelchair in airports. I can travel, but I need to have the hotels specifically where I am, no long drives. I can work, and I work a lot, but I need to work from home. If I need to go out, I need to understand how to manage the meetings. But it's already like automatic in my head. When someone else is hearing about it, it sounds insane. Because it is insane. We kind of normalize it.
Yeah, I think what that's so accurately portrays is how complex endometriosis can get, and honestly, in general, how little we truly understand about the nature of the disease, because it can be very localized, it can be very simple, or it can be very, very complicated and can affect, every organ, as you were saying, Tammy, and it can affect you in very complex and nuanced ways. So on that point, tell me what happened the first time you went to the doctor and said, I think something's wrong. Like what what did you tell them, or did you not know what to tell them? How did that interaction go?
Well, the first time I realized that I have endometriosis, I sent an email to my OBGYN. She was my OBGYN for 20 years. For me, she was like, she saved my life with stopping my period. And I emailed her and she said, no, you don't have endometriosis.
Wow.
And then a friend of mine told me that you need to keep searching that if that's what you think you have. So I found a surgeon here in New York. I went to see him and he said, yes, you have endometriosis. IBS is bullshit, sorry for the word. But he didn't explain anything to me. He just sent me home doing an MRI. Obviously, he didn't see anything, and I had to do my own research. I didn't have very good experience with doctors, I must say, until today I found the right team for me. But I had to search myself. There was no like a moment with the physician that, oh my God, now someone understands me.
I was just going to build, you bring up a lot of IBS and you asked me about my symptoms and I still have IBS symptoms and I didn't even think that it, even when you asked the question, I didn't connect it, but they are related to endometriosis and IBS. I agree. I find is just the catch-all they give women in their 20s to explain our pain. And that's it.
But that's something I don't understand. If you already have a diagnosis of endometriosis, it's an inflammation in your pelvic. IBS is when you don't find anything that can cause problems in your, in your GI, but you do have a problem. So why do you call it IBS?
Yeah.
People are so...
And probably many things, because again, endometriosis is not well diagnosed, it's not well understood, and the treatment for it can be a lot more complicated. And I think sometimes people shy away from the complicated, which is why we're having these conversations, because it's only in having the discussions about complicated nuances that we actually, I think, empower and educate in a way that's meaningful. Right? So IBS is easier. Like there's nothing to do for IBS, right? You're gonna maybe change your diet.
And I know a lot of people have IBS because most of my friends have IBS at this point.
Yeah. For 20 years, they told me I have IBS. 20 years. Wow. I saw 8 therapists because I was so stressed from leaving my house because of pain. So they call it IBS for 20 years. Then eventually I was diagnosed with endometriosis, inflammation outside, and mast cell in my colon, so inflammation from the inside.
Yeah.
And they call it IBS just because they didn't know to give it a different name.
And is that why your OBGYN told you it was an endometriosis? Like, what was her reasoning?
I have no idea.
And you don't know. She didn't explain that.
Yeah,
because that's just it, it's endometriosis, not IBS. But if you acknowledge that it's endometriosis, then you have to treat it, right? You have to come up with a treatment or management plan. And that can get a lot more complicated, right? And it might need to be multidisciplinary, and it might need to involve kind of other providers sometimes, depending on symptoms and degree of symptoms. So I think that's a big problem. And I know actually, and we're going to get to your SymptoLab in a few minutes, but I know that a big goal of yours in research is to help women understand that there are a lot of other diagnoses, right, that come along with endometriosis.
Yeah.
And so can you give us just a few of those? What are some of those diagnoses that you think are related? Now, we're not saying one causes the other.
Of course.
But we're saying that they could be found in the same person at higher frequency, right?
Yeah. So there are different things here. The way I see it, and that's what I did in my research, I think there's direct damage in endometriosis and there's the indirect damage. The direct damage is if you have something in your pelvic, which also can be indirect, but let's assume for a second the pelvic is endometriosis. But what happens when one organ is affected by endo causes a chain of events that eventually damage other organs far from the pelvic, or if you have inflammation from the endo that can flare up other diseases that can be eventually a result of endo flaring when the endo is flaring up. Like imagine you have appendicitis once a month, it's flaring up for like years. Do you want to tell me that appendicitis is flaring up for 10 days and then 3 weeks stop and another 10 days for 20 years won't affect the body? I mean, obviously, every person is going to say it's going to affect it. So how come we're going to understand that endo can affect that way? So that's one thing. And in my research, based on what I have, and I can give an example, I I always think we need to understand the mechanism of the pain the person suffers from in order to get the right treatment. Because getting the wrong treatment or no treatment is a problem by itself. So just, a few examples. I lost my voice. For 2 years, I couldn't talk. Like I could talk barely. I would like very, very softly. And when I got my period, it got really, really bad when some of the endo symptoms were flaring up. And then, of course, no one believed me because it sounds crazy. How can your voice relates to endo? But then I saw the pattern and I can predicted it. So I did the same test in the next cycle on good and bad days of the endo. And suddenly they saw the difference. And they saw that when my endo is flaring, my pelvic inflamed, causing silent reflux, goes all the way to here, damaging the vocal cords. And in good days, it looks perfect. You don't see anything. So obviously, it's not endo. I don't have endo here, but it's indirect damage of the endo, right? I mean, obviously, one option is to treat the endo, give us the birth control, do the surgery. Maybe there are new medications, but it's not always working. And if that's not working, at least let's try to control these indirect effects. So the endo going to go away, like here, but let's control the heartburn, so I won't lose my voice. Or I had another disease that was flaring up, and it caused allergies. So I had eye allergies and sinusitis once a month.
You brought up the eye allergies, and when you brought that up, I was thinking I've had all these symptoms that recently I can't explain, and I don't know what they're related to, but
so everyone can be different mechanism, right? But in my case, it was another disease called mast cell activation that can flare from either from the inflammation or the estrogen. They don't know, but we do know it's flaring from the endo. And that's caused, instead of getting antibiotics for sinusitis and instead of getting steroids for the eyes, I had to get medication for mast cell to control that. And then instead of, again, using this methodology of finding patterns and correlation, instead of getting the same treatment that is so strong and increased fatigue, and fatigue is such a huge problem in endometriosis, I told them, let's take like a light treatment for the entire cycle, and let's take the right and strong treatment the day before it's going to flare. And then, I can make the good days better and the bad days better. So this is how I kind of learned how to understand all of...
No, and I think there's also some associated conditions that are diagnosed with higher frequency in patients who have endometriosis. And so some of those are things like migraines, right? I think it was some of your research that I was
just
looking
about
at.
that.
Yeah, just about the associated conditions.
So we did a study looking on women with and without endo, and we found about, I think, 900 conditions symptoms that can come with endometriosis, and we took a few of them and tried to explain the mechanism behind them. Not just this is the only mechanism, but this is one possible mechanism that can explain, for example, sciatica. Obviously, we have sciatic pain in endometriosis, but they say it's really rare if you have endo on your sciatic. But if you look on the numbers in our study, you'll see that 40% of endo patients suffer from either sciatic pain or pain that's radiating to the feet. Obviously, not everyone has a sciatic lesion, right? But there are other mechanisms that can explain that, and that's what we did in the paper. So we showed, we took a few examples and gave different explanations, just not as this is the only one, but just to open the mind for physicians to see, okay, this
maybe these are related, right?
Yeah, and it was maybe like the voice and allergies, by the way, was a huge, so many studies showing allergies come with endo. But there's also like fibromyalgia. And then there's the question, is it a real diagnosis or not? So we need to be kind of careful with every diagnosis we find, but we need to start looking at it.
But I think why I bring it up is that I think it's very helpful for women to also understand that if they have maybe some of these other conditions, that there could be, and this could all be an associated type of diagnosis. Like maybe it is all underlying endometriosis or as part of that package of endometriosis, and we just they haven't been diagnosed, or they may not fully know. And I think obviously, yes, a lot more research needs to be done to the nuances of the disease, because as we said at the beginning, it's very complex, and for every person it's different. Some women have more straightforward disease than others. Sometimes we find lesions in the lung, for example, and people they're coughing up blood even. And it's from endometriosis. So the degree of symptoms can vary and the severity can vary.
I once went to a doctor before I got to work with that as a living, and I still didn't know what I had. And he told me, I never saw a patient with so many diseases. As a patient, it breaks you completely. Like, I'm the only one suffering like that. And I think 2 years later, when I got all the diagnoses I had, I don't have 10 different diagnoses, and I'm not the most complicated case he ever saw. I'm just a woman with one disease that is a multisystemic disease.
Yeah, it's multisystemic. It's not always just pelvic, right? It shows up in very many ways. And we just have to be open to it, I think, to truly diagnose and to treat effectively. So let's talk about that a little more. How did you first come to receive the diagnosis?
It was a very serendipitous experience for me. I was seeing an acupuncturist, and I mentioned that I would want to also use it to support fertility. I knew I wanted to get pregnant. And she mentioned your center. I was like, there's an amazing center here in New York. You should, like I said earlier, go check it out. And I think I got a cancellation on your calendar because I saw you less than a month later. And when I went into my exam, I didn't have necessarily some of the traditional symptoms, and we were going to do more imaging, but you saw from just the physical exam I had fibroids. So right away we knew there was something happening and we needed to treat the fibroids, most likely for me to get pregnant. And so when we had the surgery, that's when we confirmed I had endometriosis. We removed it. Very fortunately, I got pregnant a few months later, and it changed my life. It was the best thing that ever happened to me. And then a year later, I was trying to get pregnant again, and I had an early loss. And knowing my history, I was trying to get pregnant, but I knew that between fibroids and endometriosis, I had to be careful about timing. So I started seeing a fertility doctor when I wasn't getting pregnant. And at some point in that testing, I felt something was wrong. We found out one of my tubes was blocked. And at the time, many doctors will tell you that's a pretty easy procedure. And so I was seeing a few doctors. I'd moved, so I saw a few doctors locally. But what was clear that when you do the surgery, not all surgeons are comfortable removing endometriosis. And because I knew I had it, I knew it could be there. I knew that was one of the reasons the tube might have been filled. So after seeing a few doctors who said they might not be able to treat the endometriosis, I contacted you again, and we did some imaging, and we saw that it had spread, it had filled the tube. And I remember you said to me, I'm happy we're doing this because I would hate for you to have done 2 surgeries, to remove a tube, which many doctors are comfortable, and then have to go back under and remove the endometriosis. And every surgery is risky, right? This would have been my second surgery I had. This was my second surgery I had last year. And so I found I had it again, and we cleared it up. But again, it puts you on a bit of a timeline of trying to get pregnant while it's at bay a bit. And so that is how I found out. It's always been tied to fertility. And I think, unfortunately, for a lot of women, they find out when they're not getting pregnant. And because I thought my symptoms were normal, and I had some pelvic pain, and my doctors always kind of brushed it off. And we found out, I'm pretty sure it was the fibroids, right? So that's for me always been connected to fertility. So there's a lot of emotion that comes with endometriosis.
Yeah, absolutely. And I think, the point about the fibroids also, a lot of times we do see a lot of these diseases together. Yeah. So fibroids and endometriosis, we see quite frequently, honestly, together. And then there's another diagnosis, which we can talk about a little bit here, called adenomyosis. And that can also be related to endometriosis. You can either have adeno and endo, or just endo. Sometimes these things travel individually, sometimes they travel together. So I think that also further complicates the picture. So did either of you happen to have adenomyosis as well?
I did. I wasn't as familiar, and you saw it in the imaging, and mine I think is a little more minor, so we didn't touch it too much. But that was the first time I had heard about it when we did the test, and we found
the testing,
they were all connected.
Yeah, of course.
Yeah.
I also have adenomyosis. I have everything else. But they told me that I have adeno, but they couldn't know how severe it is. They took my uterus out recently, and then the biopsy confirmed that.
Yeah.
But honestly, I don't know if you can tell which symptom came from the adeno or which from the endo.
I think that's a good point. I think we were talking about the fact that sometimes they clear out the endo and then they just say, well, any pain you have that's remaining is adeno.
Yeah.
Because the so adenomyosis is actually inflammation. It's when these endometrial cells grow within the myometrium of the uterus. So it is very difficult to separate adenomyosis from the uterus itself. So those who want to maintain the uterus for pregnancy, we're very careful about too much surgery to the uterus for adeno purposes, because it's really not going to truly get rid of the disease and will only kind of compromise the uterus to try even and resect it. So often adeno is left in those who want to be pregnant. And then, so that's why a lot of surgeons will say, well, whatever pain you still have is likely the adeno. And so was that your experience? You still had pain after the endo surgery?
That's what I've been told. I had the surgery. Most of the thing, it took a year until I got better. But in this year, they told me, so either whatever you have is not endo or whatever you have is adeno. Mm-hmm. But that's it. We're done.
And then when they removed the uterus, did that pain get better?
I'm still recovering from that.
Okay,
so tough
still
to say. Yeah,
tough to say. Got it. My question to all of that is: Did you both feel sort of dismissed by the medical system in terms of your symptoms, or did you feel like you had it acknowledged and treated in a way that was helpful?
Yeah, I definitely felt dismissed. It was funny time when I was seeing you, because I felt both very lucky to have found the center, to find you, and I got pregnant, and I felt very lucky that all the stars aligned. I really felt like there was something that brought me to you and your center, and it was very successful. But I felt very angry at the same time that I'd had pain, that I knew something, that the gastro pain had gotten better a little bit. But I'd held pelvic pain, and I would bring it up in exams, and I was told maybe it's a mental pain, and I just you wish you'd known sooner so you could have done something, and then there's a lot of emotion too of not finding out, because then it might affect for anyone who affects their fertility, and that makes you really angry. And I haven't found many. I've had a great experience with you. I always felt really heard, but I think there was dismissal of pain, but also escalation to remove a lot or start fertility treatment sooner. I know we talked a little bit about that, and that's also very emotional when you're trying to process this information. And I had a surgeon tell me, I'm going to cut your uterus and you're not going to be able to have a delivery through your uterus. And that was really hard to hear. And we hadn't even had the surgery yet. So a lot of dismissal, a lot of anger. But then when you find a doctor and a team that you trust and you feel like you're getting heard, there's a lot of relief that comes from that, and it can be life-changing. Well, that was my experience.
Yeah. Tammy, I know it's been so hard, Tammy. I know.
I think it's
20 years, right? 20 years of feeling.
More.
And so I think what's so amazing about your story, though, is that you took it into your own hands.
But it was because I've been dismissed.
Yes, I know.
We always talk about the diagnosis. You do or you do not have endo, and once you get it, everyone's like, oh, now I've been heard. Now everyone's going to listen to me. And no. I had the first 20 years, then I had the 2 years in bed. No one listened to me. Then I got the diagnosis by myself. I got into surgery, and I still had symptoms, and not because the surgery wasn't good. First, it takes some time to recover, and second, again, the damage. And at that point, everyone told me, again, we did ours. It's in your head, or it's not endo, or, we don't know, but it's not us. And then again, you're a postdoc, you're stressed, you work too much.
Wow.
And this is why I started researching myself, because I needed answers. Like I remember I went to a psychiatrist, and because I had episodes of depression, and but it wasn't 24/7. It was a few days a month, and I just started, understanding myself. And he told me, "Well, of course you are depressed in your condition, and you can't work." And I'm like, "Oh, I do work. I work. A full-time job, just from home." So, well, of course you work from home, okay, but still, how can you not be depressed in your condition? And I remember living, and he gave me a Shirazian. I went outside and I saw my sister, and I was like, I don't know, you think I'm depressed? I think I have an issue. is that also something I have? Because I don't feel depressed. It's only a few days a month. And we're like, okay, maybe he's right. That's very dismissed, because I told him, right? I told him I'm not depressed. It comes and goes.
Right.
And eventually it was a PMDD. And for a year, I took SSRI for no reason. It didn't help me until there was one therapist who actually saw the graphs and numbers that I showed him. And we saw it's like after ovulation.
Right.
It's PMDD. It's not. So I said, there's this one example you dismissed, even when you have the diagnosis.
Well, so I think that gets to another overarching theme to all of this that's super important, and we actually talk a lot about it on this show, is that endometriosis is a chronic and recurrent disease, like we see with a lot of diseases, like fibroids, we talk about the same thing. And the issue is that when it's chronic and recurrent, it doesn't mean that you treat it once and it goes away. It doesn't even mean that one type of treatment can be the be-all and end-all. It means we need to be thoughtful about how we approach it. We need to be multidisciplinary. We need to pull in, I think it's so impressive you went for acupuncture, for example, because I often tell women when they have the diagnosis that integrative health techniques might be helpful, like acupuncture. So that is one tool in our toolbox, right? But so is nutrition support and exercise and, all of these other elements and pain management sometimes, just making sure that if you do have chronic pain, you have something for pain that can really help you moving forward. And I think there's just so much that we can layer into the care. Once we recognize and sort of underscore the fact that these are chronic and recurrent disease processes, we will do so much more for women that way.
When you get the diagnosis, there's the big step is surgery, but there feels like there has to be more. And that's what I loved about the Endometriosis Center. There were nutrition advice, there was other guidance, I participated in a program because I was told, I got it removed, and then between pregnancies, a lot of women will go on birth control to help some hormone management, but I couldn't do that between pregnancies, and I was like, there has to be more than just surgery for all my pain or very restrictive diets, and I feel like that's with women's health. There needs to be more research and more information, because surgery cannot be the only option to live with them.
And surgery is not the only option. Yeah. I mean, we have hormonal management, but of course, many women are different. So some women try hormonal management and it's not enough, but we have progesterone therapy. We have newer medications now that drive down estrogen. So they're the GnRH antagonists. They go by the generics Relagolix and Elagolix, and they drive down a woman's estrogen. So they can have some other side effects, which we have to also be thoughtful about, but they can really drive down disease and help with pain. And I have many women who use them successfully. So there is medical management. There even is a movement to try and start women on medical management before they even have a diagnosis, to try and reduce sort of the propagation of disease, reduce the idea that endometriosis disease is getting worse, because not everyone can have a surgery, right? Not everyone in the globe maybe has access. So what do we offer women who are in areas where there is no access? Maybe we first offer them hormonal management to try and reduce the pain and reduce the endometriosis. So I think, again, everyone is a little different, but layering in ways that we manage is very, very important. I want to talk a little bit about what was the moment that sort of helped you kind of have a breakthrough in understanding endometriosis or reaching your goal?
For me, I think the surgery, to be honest, we found it. We had a hypothesis, we had good imaging, but we went in and we confirmed it. And one thing about, I mentioned for me, it's very fertility related. It's nice to find something that you removed it, and it felt like I had some answer and I had a chance, and it opened up opportunities. So for me, that was the aha. And similarly for my second surgery, that one was tougher because it was removing a part of my body, which I found emotional to make that decision. But again, when you confirm we found it, we removed what we could, it looks clear. for me, since it was about getting pregnant, that was such a big moment for me. I was like, now I have a chance to grow my family. I have options that I can keep trying to explore, and we'll see. I'm still trying to get pregnant now, and so we'll see if that worked. But it's more options than I had before the surgery.
Absolutely.
Today I celebrate my birthday and the date of my first surgery.
Wow. So for both of you, the
Yeah.
aha moment was surgery.
At
It's
the point where they
interesting.
took my endo out.
Yeah.
We talked about the aha moment, but it was interesting because I got pregnant, so I didn't realize till much later when I got my period, right?
Yeah.
Maybe a year after surgery when things, I had a moment where I realized I wasn't dreading my period, that the pain, that I wasn't going to be home until I could take some pain medicine. And then I realized, oh, there was something wrong, that it shouldn't have felt this way, and I shouldn't have had pain. And that wasn't necessarily a aha moment, but that was a moment of, like, I shouldn't have had to live this way, and now I've had some answers, and I deserve to not have pain. I think women deserve to not be in pain and have painful periods and all the pain that comes with all of this.
Absolutely. And having, I think, as many answers as we can provide, which, medicine is not perfect, definitely. We don't have every single answer, but I think to be able to provide some answers and reach some diagnoses and help people understand the nature of the disease is like a key function in and of itself. It helps, right? Reduce anxiety, help your mental state, because it helps you understand what's going on.
Everything, because for 20 years, you say you have something, it's called IBS. There's no test showing you there's something wrong with you. And then you do the surgery, finally got a biopsy. Again, I woke up from the surgery, it was a no, right? So 10 days later, I got a yes. And then I had to continue with all the other diagnoses. And for them, they were actually tests. Because the endo was kind of wider at that point, you could see the other damages that are there and get the other diagnosis. And you suddenly see tests that is positive for that, and positive for that, and positive for that. After 25 years of, it's in your hand. It's insane. It's
and actually, so maybe that's part of the origin story of SymptoLab, right?
Yeah.
Like, why have SymptoLab, and why is it important for physicians, to use this platform? So tell everyone a little bit about SymptoLab.
SymptoLab, my baby. So SymptoLab is a decision supporting tool for physicians that help them provide personalized care for patients. What we do is we take symptoms data from patients that they monitor daily. We analyze that using machine learning models, statistical analysis, LLM models as well. And then this analyzation, we analyze it from symptom level to body level, system level, so we can explore the multisystemic effect of the disease, and then provide that to physicians so it can help them understand the big picture, but also the details. We see today on studies that an endo patient has an average of about 30 symptoms per patient, right? A patient goes to the doctor asks her usually what you're suffering from, and she starts telling them, and then the doctor is like, give me the worst 3 symptoms, because he can't hear 30.
Right.
Amazing doctor, but how can he hear 30? But she had 30. Like, how can I decide between a migraine, a pain in bowel movements, urination issues, pain after eating, like so many? How can I decide the 3 top? So what that's we're doing, we're taking everything into account in these reports and helping physicians see. And then, talking about pain management and food, or I don't know, physical therapy, so many treatments. And we're putting it all together into the report, and taking Oura Ring and Apple Watch, every data possible, so physician can have everything in one report as short as possible. They don't have enough time, but it's science. It's not just visualization. And when it's science-based, physician can actually rely on that. So if someone has, for example, problem with their voice, and it doesn't sound like it's OBGYN, but the OBGYN see there's a pattern there and it's hormonal, maybe it will give them the hint of, okay, it's something here. I need to work together with the ENT to solve that.
Yep. I love that. As you know, I'm a big supporter of SymptoLab and this idea that we should help educate the physicians about, the whole host of symptoms that each patient has. And it's so individual. I can't say that enough. So
individual.
again, sometimes you hear one story, someone might hear your story and say, oh, well, I don't have all that, right? Mine is way simpler. Maybe I just have pain on my period, or and I don't think I have any associated symptoms. But I think being able to really think through what you're noticing, what your needs are, having your doctor know what you're going through and experiencing each month is really going to elevate the level of care around the disease. So,
exactly. It has to
thank
be
you.
personal. What we see today, even pain, what is pain? It's
Right.
so it's different.
Individual.
And
Yeah.
especially in endo, pain
Yeah.
can be the worst pain you ever had for 20 minutes. And it can be like, you can live with the pain, but it's bad, but it's going to be for 10 hours. What number would you put on that? Can you put a number on that? And, and the research team that we worked on that study, I think for months, we discussed this option, like what to do, how can we measure that, until we developed in SymptoLab the idea of personalized pains, personalized pain scale, sorry. And we work with each patient for hours to understand how to question them. They don't even know which symptoms they need to monitor until you really go deeper into each symptom. Like my husband's always laugh at me when I'm talking to a patient. Like, the pain is different if you sit with the leg here, with the leg there, you're lying down, you're sitting down, you're standing up, you're moving, like every little thing. And then based on that, we understand how can she send us the data so we can actually analyze. How can we make a subjective pain to objective ones so that the data can actually mean something to physicians.
We always think about now everything we've sort of learned and taken away from our personal journeys, and now kind of understanding more about endometriosis itself. So if you could talk to a woman, Christine, who is managing endometriosis, so she either just has symptoms maybe, but doesn't know what it is, or maybe has even had the diagnosis, what would you say to her? What would you say is something very important that she knows?
I would tell her to trust in herself and believe in herself. I think that as women, we know our bodies, we know when something feels wrong. And if you are not feeling great about the advice that you're given, if you continue to be in pain, trust in yourself that that's not okay. And you might have to be, you have to be really proactive in this process. And that's unfortunate, but I think the more that you believe in yourself and that you deserve better and you deserve to find answers, you will get there. I wish it didn't have to be that really proactive journey, but that's how you get to a better place. That's how you start to manage it. And that would be my advice to her, and that I believe in her and that she should believe in herself, because she knows herself. So.
I love that. I love that. Believe in your symptoms,
Yeah.
Believe in yourself. And yes, we are a community here that, I mean, we believe in each woman's story. So I think that's very powerful.
It's funny because I wanted to say the same thing. When I sent the email to my doctor and she said no, I was with my friend and I cried. I'm like, what to do? Who should I talk to? And she was like, you know who you need to talk to? And I was like, who? Who's the doctor she's going to say? And she was like, you're the only one who can know what's going on with you. So believe in yourself. I remember that until today. And that was a really big aha moment. This is how SymptoLab started. And that's what I say to the next one, exactly what she told me. Believe in yourself, trust yourself. And if the physician you go to tell you just it's in your hand, then go to the next one until you find the right one for you.
Yeah, 100%. I think knowing your body, knowing what you're feeling is the most important way that you can empower yourself about your health. So education, talking to other women, community, really researching, I think sometimes these conditions and diagnoses, but hopefully platforms like this will help educate so that, other women that are out there can think to themselves, oh, I have what she has, maybe this is, might be going on for me, and kind of seek out the care that they need. And so we always want to leave on a hopeful note, although I feel like this whole thing has been hopeful because, even with your, tremendous journey, Tammy. Like, I can't say this enough. Even with the years that you have suffered with endometriosis and the countless surgeries and just the years of getting dismissed and maybe not reaching the goals that you wanted, you've turned it around and really created something so hopeful and positive for other women from it. So I think that's tremendous. So we all have a role to play for ourselves and for other women. We educate and empower each other together. So anyway, what is the message of hope for women, or the message of hope about endometriosis? Is there hope for research or progress maybe?
I think more and more women suffering from that, working together for a brighter future, together. I see it's in SymptoLab, the women working with me.
Yeah, I think like what you said about community and continuing to share with other women, and the more we talk about it and the more we insist on support and hopefully more research and more conversations, I think that's amazing. You learn more. And I think on a personal hopeful note, if you're struggling with endometriosis and hoping to, get pregnant and have a baby, I really believe my daughter is so special. And I believe that if I hadn't had the surgery when I had it and got pregnant and all of that, right, and maybe it was really painful, but her name actually means hope, and she is our hope. And I don't think she would have been our child if it wasn't for all the journey and the timing of everything, right? It's everything coming together. So I have to believe that that's how the world works, and that's how it came together for me. And I have hope in the future. And so I would just share that. I know it can be really tough, but women are really strong. We are strong together, and we find ways to move forward and have a better future. And so that's my hope.
Absolutely. And my hope, I think, would be that there's multidisciplinary approach. So if one thing is not working for you, really think about pulling in other aspects of care that will help you with pain or fertility. We have lots of tools, and I don't want any woman to think that there aren't more choices or more options than they think. If surgery doesn't feel like the right choice for you, you can try alternative therapies, nutrition, pelvic floor therapy, which we didn't talk about, acupuncture. There are a lot of other modalities that can help you feel better, lead a better life, have less pain. I mean, there's even now, and I'll throw it in at the end here, are the GLP-1s, which are starting to show some anti-inflammatory results. So maybe pulling that in for pain that is inflammatory in nature could be an area of research in the future. So I think that there are lots of tools. And I think as we keep learning about our tools, but the key is we need to always be thinking of women in the forefront of these new research studies. How are we going to treat very chronic and debilitating disease like endometriosis, right? That needs to be on the list of things that we think about when we have new tools and treatments. And I think that's the key, because it's not always up there on the list. So the more we talk about it, the more hopefully it gets some attention.
And to be developed for women.
To be developed for women, by women.
By women for women. Recently, a year ago, I think, someone asked me, why don't you use the same platform for men? And I was like, okay, but we developed medications for men and women on men, right? And we saw that it's not supposed to work for both. We're different, right? Yeah. So now we're developing digital tools. We need to develop it for women. For women. Not to take the one for men and then
especially when it's a disease that predominantly affects women, endometriosis, although it has been found in men. Case reports, interestingly. Again, this enigmatic disease. It really is enigmatic in the sense that we truly don't understand all of the nuances.
Yeah. But to be hopeful, I do see so much more researchers now working on women health, not trying to take men's health and push it, to women health without even checking, understanding. We need to try and understand the woman's body from scratch.
Absolutely.
To understand it works differently.
Absolutely. Don't take a circle and squeeze it into a square, right? That's sort of how I think about it. It's not going to fit. But this was so great. Yeah. Thank you both so much for being here. This wraps up our session on endometriosis today, and I really hope that our audience learned a lot about just the personal narrative, the disease itself, symptoms, management, and all the nuances of what you've been through. So thank you again so much for sharing.
Of course, happy to.
Thank you
Thank you.
for having us.
Yeah.
Thank you for joining us for today's episode. Endometriosis is a chronic and often debilitating condition that affects 1 in 10 women. You deserve to be seen and heard and to have your questions answered. Health Starts With Her is a community about honest conversations, patient stories, and about learning more about endometriosis and other conditions that affect you. Please share these episodes, please join us with questions, and please let your community know. A special thank you to our sponsors, Cooper Surgical, Serene Endometrial Cryotherapy, and Altiva RCM. We couldn't do this without you. Thank you for being here and being part of this community. We'll see you next time at Health Starts With Her.